Good morning. This is Richard Wexler, and this is Caring in America, the podcast for caregivers and care recipients. And as you folks can see, once again, we have Steph Barrow with us. Good morning, Steph. How are you?
Good morning, Richard. Doing well this morning. Thanks for having this conversation again. We're going to continue on with what we've been talking about the last few weeks about who's on the home team, why are those roles important. So last week we dove into different aspects of care, whether it was care in the home, looking at going into like a senior living community, or family and friends in as different options. So let's dive in a little deeper on that. The home team's goal is really to help educate people on all different aspects of aging. So after we talk about different areas of care, next comes the cost of care. Do you want to talk a little bit more about that?
Yeah. Where I'm sitting, folks, it's early in the morning, little after 8 o'clock. And the reason I say that, this is kind of a somber subject, and I've been trying for all the 20 years I've been doing this to get people to understand. As we age, and as we talked about last week, stuff happens. A fall, it's an accident, a fall, an illness, combination thereof. And I talk about the fact that 95% of us, literally about 5% of us, as we age, will fall asleep one night and not wake up. But the other 95% of us are going to need some form of care. Talked about that from a few hours to a few years, for most of us, something in between. And the reality is, care has a cost, and that cost is significant. When we talk about care in the home, the average price around the United States is about $40 an hour. You can do the math based on how many hours a day someone's going to need care, figure out what that bill is, let's say on a monthly basis. In some of the larger cities, Los Angeles, San Francisco, Chicago, Dallas, New York, it's closer to 50, and in some places, it may be over $50 an hour. Okay, it's $50 an hour, but then again, do the math. Do you need someone for 3 hours, 4 hours, 5 hours, 10 hours or more a day? You can see how much that's gonna cost. When we're talking about someone moving to senior living, on average around the country is about 5,000 a month just to get a room. And then based on the amount of care that individual needs, you can add care, the bill for care on top of the 5,000. But again, you get into the bigger cities and you're probably talking six, seven, eight, nine or more, that's thousand or more per month. When we're talking about the need for a memory care community because someone has dementia, a form of dementia can be Alzheimer's. Someone has Alzheimer's. They really need the security of what happens in a memory care community. In a lot of places around the country, that's going to be 10, 12,000 or more per month. So we're bringing in these home team members around the country to really start educating people. And what I've been talking about forever, we need to educate and understand this little word called care and its cost early in life. Once someone starts making money, it isn't just saving money for retirement, it should be saving money for retirement and care. I hope that helps a little bit, Steph.
That does. And I know you mentioned that you were talking to somebody out in, I think, Boston area. Did you want to talk about a newer trend that they're seeing now that we're having an increase in people that are looking at senior living communities and potentially a decrease in the staffing that's available?
Yeah. So what the reality, folks, is that memory care in the Boston area can be over 15,000 a month. And what we're finding, as Steph's talking about, from the staffing perspective in the memory care community, and also the amount of care that an individual may need, and we've talked about this before, you may have to supplement that care with an in-home care agency actually coming into the memory care community and providing additional care. Then you're looking at two bills per month, the memory care community plus in-home care. So based on how many hours you may need in-home care, you could easily be looking at a combination of both bills that are over 20,000 a month. That's April 2026 today. What's it going to be in 2 years, 5 years, 10 years down the road? Don't know. All I know is it continues to go up. So, really educating people what we're doing from the home team perspective about this, really getting people to understand care is real. Most of us are going to need it. And do we have the funds to pay for it? Hope that helps, Steph.
So, yes, now talking about how much it costs, how do we pay for it? What other options are out there? Because I don't know many people that can pay over $20,000 a month on top of their own bills and housing, especially if it's for like a parent or grandparent.
Yeah. Oh. So the reality is, and we did a whole webinar, a whole call about this back in the latter part of 2025. There's about 10 different ways to pay for care. I'm going to talk about a few of them. The first way is the piggy bank. What does the individual that needs care? Let's pick on mom. That's mom. What does mom have in her piggy bank? What does she have to be able to afford the bill for care? That's one. Then we may look at family and their piggy bank on top of what mom has. Is there one adult child? Are there multiple adult children? Can they supplement the money that mom has for care? So think about what I'm saying. In our family, we wound up taking care of all four of our parents. I know that's a little unusual. It's not going to happen to most people. But what if you are taking care of mom? What if the kids and mom have to put their piggy banks together to afford care? Then what happens if there's an additional loved one or more that also needs care? One of the professionals, few of the professionals that we have on the home team, reverse mortgage. You're staying within the home. You want to utilize the equity that's built up in the home to pay for care. That's a great way to do it. If an individual is young enough and healthy enough, they may qualify for a long-term care insurance policy. And there's been so much pushback over the year. Well, those premiums are a lot, and this really isn't going to happen to me. Folks, 95% of us are going to need care. There's a very good chance it's going to happen to you. Another professional that we have on each home team is what is called a life insurance settlement. What does that do? If someone owns a policy, usually 100,000 or more, they're aged. Maybe they're 75, 80, maybe they're older. Do they really need to still have that life insurance policy? And they're professionals that we're working with that can cash that policy out. Maybe it's going to pay for some modifications on the home if they're going to stay there, or modify the home before someone sells it. Or maybe it pays for care, or maybe a combination thereof. A misnomer that's out there, we've talked about this a lot, and people in the industry get these calls, as I have quite a few times. It's not going to be a problem for mom or dad. They've been on Medicare for 20 years. Folks, Medicare, the way it's currently set up, does not pay for long term care in the home, at a community, at a memory community, etc. It'll pay the part of your bill in the hospital. It'll pay for so many days, usually up to 100 with the certain qualifications in skilled nursing. It'll pay for a walker, durable medical equipment, but it's not going to pay for long-term care. I really encourage you to come to our website, aplantoage.org. Remember, always, that's a plan to age with the number two. And you can find all these different 10 plus ways to pay for care. Again, hope that helps, Steph.
Yeah, and if you're looking at trying to find that resource that we had at the end of last year that kind of dives into those different ways to pay, on our website, it's under care and then cost of care. And we have it set up in a blog format where you can either read along, listen along, or watch the recording as well. So outside of that, Richard, is there anything else that you would like to share with the audience regarding the cost of care when you're starting to look at this? I know if this is your first time hearing some of those numbers, you were probably in shock. It's not something to take lightly.
Yeah. In reality, Steph, and I talk about this all the time, that's how much in-home care costs. That's how much living at a senior living community costs. Those are real numbers, and they're only going to get more expensive. For many, many, many families, this may be millions of families around the United States. The reality may come in another component. And you know what that component is? Something we've talked about a lot: the family having to provide care, a friend or a neighbor having to provide care. So think about what I'm saying. Many adult children don't live close to mom or dad anymore. They've moved potentially many states away. Sometimes they may even be out of the country. And now something happens to mom, something happens to dad, and they are the only ones that can truly provide care because of the costs that we talked about. When we talk about planning, this is something that you really have to be thinking about and plan for. What are you going to do in your given situation based on your life? You have a spouse, you have a partner, you have children, you have an active life, you live far away from a loved one. How are you going to adjust your life to potentially move back in with mom, or fly there many, many times to help take care of her? That's why we talk about planning so much. That's why the home team is really going to be educating about all these issues, because, folks, if the dollars aren't there to pay for care, and you can't bring in a professional or move a loved one to a senior living community. I mean, you're basically down to two choices. You are or you are not going to provide that care for a loved one. I know what most people are going to do. Hope that helps, Steph.
It does. And if you're looking to find where your local home team is, we do have the list that we're still building these teams, but we have some of the cities that we're focusing on right now on our website under resources. You can find the interactive map. And then also for professionals that may be listening, if you're wanting to be on one of the home teams, please reach out to Richard to set up a longer discussion and see if it'd be a good fit.
Fantastic. Thank you, Steph. And folks, until we meet again, have yourself an awesome day.